as the number of people living with the coronavirus increases. We're seeing the largest disability population boom in our nation since AIDS and HIV in the 1980s or since polio in the 1950s. Long haulers living with COVID-19 are now people with disabilities. And while this number is growing, the critical supports and services to support the disability community are constantly under attack. The attack on the Affordable Care Act could risk coverage for people with pre-existing conditions, but it's much bigger than that. It endangers the disability community's ability to become employed, to get married, to have a family, to leave an abusive relationship, or even just to exist in American society. 2/3 of the victims of the coronavirus are tied to the nursing home industrial complex, a system that the Trump administration began actively deregulating, and the alternative, home and community-based services for seniors and people with disabilities, has not seen one single increase in funding from 4 different pieces of coronavirus legislation. This is a part of a larger attack on our social safety net. The Trump administration's payroll tax cut put Social Security clearly in the crosshairs of this administration, threatening to cut off benefits for the Supplemental Security Income Program in 2023 and for the Social Security Disability Insurance in 2021. A recession and a pandemic is categorically the worst time to pull the rug out from those in need. 1 in 4 people in this country have a disability. We are your coworker with lupus, your aunt who's a cancer survivor, your autistic kid, and your friend living with depression. We need to act, and we need the people who love us, who live with us, who work alongside us to join us.